So Yara is a healthcare professional with more than 9 years of international experience in delivering and managing projects within the healthcare sector. But most importantly, Yara is the co-founder of Health 2.0 Egypt that supports digital health innovation in Egypt and the region. So hi Yara, welcome today to our conversation. First, I'd just like to start off. Could you perhaps tell us more about the status of healthcare innovation in the MENA region?
Thank you very much, Thomas, for inviting me today. I wish that we were actually in Slovakia, but I hope that we will join the live event at the end of the year. So first, let's start off by talking about the healthcare system in the region. While you have Qatar has one of the best healthcare systems in the world, the situation, for example, in Yemen is unfortunately much different. And then you have most of the countries are in between. And this, of course, affects the level of the market maturity. So this affects the strategies put forward, the regulations, the level of investment, the infrastructure available. And then you have, and this also affects the market drivers that drives innovation. So for example, UAE, Qatar, and Saudi, there's a lot of government-driven innovations. The governments have been doing a great job driving healthcare, digital health transformation and innovation. So recently, not recently even, just yesterday, UAE has launched a program, I think, called Bold Youth Program that supports entrepreneurs in health tech. Then when you come to Egypt, Jordan, and Lebanon, these countries have a massive growing population. Most of the healthcare spending is actually out of pocket. So Egypt has almost 70% out of pocket spending. And then also the healthcare system in these countries is mostly patchy. So it depends on your level of income, and it depends on your place in the country where you can get access to healthcare. And with this, most of the innovations in these countries are driven by entrepreneurs who want to change the system and want to improve the situation to the access. However, in the past 10 years, we've been seeing a lot of adoption to technologies. So in 2003, robotics have been introduced, and it has been a great success. So definitely adoption rate is less than in Europe and the US, but it has been a massive success. And also there has been a lot of investment in digital health platforms. So earlier this year, before the whole pandemic that stopped the whole world, Visita, an Egyptian healthcare company, and Okadoc, both of the companies are actually doctor booking platforms, have raised a combined of $50 million, which is really great for the region. And I think a couple of days ago, Shifee, which is an online pharmacy platform based in Egypt that focuses on patients with NCDs, have raised a Series A 7-figure, undisclosed yet. So we've been seeing actually a lot of action, and it's quite interesting times to be in the healthcare, the digital health scene right now. Most of the startups that we're seeing are focused on the service industry. So they focus on improving access while decreasing costs, and more, let's say, clinically sophisticated startups are yet to be seen in the region. So yeah, it's actually quite exciting, and there's a lot of interesting initiatives that are happening now in the region.
That's a great response. And I mean, a lot of this innovations seems to be sort of advanced or hyper fueled by the situation with COVID-19. Do you see things the same way? As in, even outside of the industry, of course, everybody is digitizing. How is this, or how have you seen this maybe in your region with this unfortunate but somehow also helpful situation?
Well, I think there are two things that we've been seeing. So a lot of the barriers that we've been seeing initially is starting to crumble. So there wasn't really an incentive for doctors. And with this, I talk about Egypt because that's where I was working. there wasn't really an incentive for doctors to change the way that they're working. And only in the past 3 months, we've been seeing people asking for a video conferencing platform more than we've been seeing in the past 4 years. We've been seeing people using telehealth platforms more than we've been seeing in 4 years. And Al-Tibbi is one of the startups working in Egypt. It's a Jordanian telehealth startup that is working in Egypt, has made like 300% growth in the past few months with demand for telehealth. On the other hand, the problem is people use technology anyway, right? So with people having more and more symptoms, they start WhatsApping doctors and texting doctors. And doctors responding to them on WhatsApp. And then if the person does not get the right answer, or that his situation deteriorates, we've been seeing cases raised against doctors in court in the past months. So the problem is that there isn't still regulations that would provide use cases for the use of technology in this situation. So it's a bit of a balance. Like, this situation is definitely driving innovation forward. However, regulations really need to catch up so that people wouldn't have any bad experiences with technology.
Right, it needs to be safe for both sides, of course, and
Yeah,
the, res
definitely.
the result is the most important. So you've been talking about some startups that have really driven their sales and their sort of business models in the last couple of months. Could you maybe describe what other challenges startups are facing these days when it comes to scaling their businesses?
Yeah, so, well, we can talk first about like the usual suspects. Long sales cycle, resistance to change, cultural barriers, low investments, and actually lack of talent. And this is one of the biggest problems. Technical talent, like software technical talent, is extremely expensive, and when they're really good, they tend to find other jobs that are that extremely high paying really fast. And these are problems that people usually describe. However, I would like to focus on a couple of issues that I see are most challenging. First, most of the startups that we've been seeing are not scaling to their full potential. So Wanda conducted a survey, I think 2 or 3 years back, and in this survey, 70% of the startups are early stage, as opposed to 50% in later stages. And we as Health 2.0 also conduct a survey each year to assess the situation of the startup. So how many startups are in the market, what do they offer, the level of investment, and the barriers that they're facing, and which stages are they in. And what we're seeing is that almost 80% of the startups in Egypt are early stage, and they remain early stage. Uh, yeah, it's actually quite a surprise. Well, not a surprise, but we think this is because of a few things. So healthcare is inherently a complex industry to be working with. And startups working in the healthcare domain have to cater for a lot of stakeholders. They have to cater for their end user, for the healthcare provider, for the healthcare supporters and supply chain. That would be pharmaceuticals. They have to cater for the payer. Most of the time, it could be the insurance. So they really have to cater for a lot of stakeholders and build their value proposition accordingly. And with that, while they start working with the stakeholders, their ideas start to get diluted by the resistance. So the idea usually is, at the beginning, you have to pivot until you find a product market fit. But when you work specifically with the healthcare providers are extremely resistant, and you keep on changing your idea to work with them. So what we've seen is that you can start, for example, with a remote diagnostic tool and end up being a social media marketing platform for medical providers. And while it's definitely the case that you need to find a product market fit, Yet you have to choose at least at the early stage, who do you, which institutions that you work with that have an open mind to try innovations, to try new things until you reach something in between without having to completely change the face of what you're actually doing to become from an actual innovation to a really non-innovation situation. And the other thing that we're seeing is actually in no, sorry, actually, and there is another thing. When you come to when we talk about companies that are focused on B2C, which is not a lot. Most of the companies that we're seeing are focused on B2B rather than B2C, and they end up pivoting until they change completely their what they were initially offering. The other thing is when you focus on B2C, this the sales cycle in healthcare is much longer than the rest of the industries, and it takes a lot of time to get customers. And with this long sales cycle, you need to have a different type of investors who are actually willing to build a market together, investors who understand the complexities of the healthcare system, understands the behaviors of adoption in healthcare provision rather than in different industries. So that's another thing that we've been seeing. In investors are not willing really to take this risk in investing in healthcare startups. That being said, this is slowly but surely changing now. So there is a healthcare investment fund that is being launched in Egypt. I think within this month it should be launched. That is focused actually on working only with healthcare startups. And behind the scene, there are people who have a solid understanding of how the healthcare market works. And so far, most of the startups, 90% of the startups that we've interviewed are self-funded. Yeah. And the other thing is that Mubadala, which is here in the UAE, are launching also a fund that is only focused on healthcare startups, also driven by people who understand the market and understand how the market is different from the rest of the industries.
Thank you for that. I mean, you made a lot of great points there, and it seems like you do have a lot of experience in these digital strategies and scaling up these innovations. Could you tell me something more, perhaps, about the platform that you're working with in regards to doing that?
Sure, thanks, Tom. So we actually haven't introduced Health 2.0 Egypt and what we do in Health 2.0 Egypt. So Health 2.0 Egypt is a chapter of Health 2.0 Global, which is a global organization it's a nonprofit organization that is based in San Francisco, and it has the biggest health tech conference in the world. The biggest one happens in San Francisco, and then different ones happen in other countries. And Health 2.0 Egypt is a chapter it's an actually autonomous chapter of Health 2.0 Global. We've started in 2014. It was started actually by my partner, Omar Shaker, in 2015. And the idea behind this was, at this point, there wasn't really any talk or discussion about health tech. So we just wanted to know who's interested in health tech, what are the how can we all collaborate together, what are the startups doing, how can we support the startups. And it started with just some meetups. And since then, we started evolving with the evolving in the landscape. And the landscape has been evolving really fast, and that's good news. Unfortunately, I don't have a presentation with me, but we usually have like an inverted pyramid shape at the beginning that shows how the ecosystem works. At the beginning of the pyramid, you have the sector agnostic, like accelerators and incubators. And with this, there is a lot in Egypt, that if you have a startup, you'll get seed funding, and then you would have marketing, financial, legal support, and so on. And the next level beyond that, you would have sector-specific support for startups. And in 2015, there wasn't really any sector-specific healthcare support for startups. And this is the part that we were focusing on. So we're focusing on doing three things: capacity building, knowledge transfer, and creating partnerships between startups and the industry. And with that, we've run different competitions and hackathons. The first one was, I think, in 2017, in partnership with an insurance company, hospital, two insurance companies, and one hospital. We run different competitions on NCDs, sexual and reproductive health, always in collaboration with the industry, so that this could accelerate the adoption of whatever comes out of this. And then going back to the pyramid, the third part is evidence generation that would lead to scaling. And this is what we want to focus on now: how to generate evidence from the startups that are actually working, and how to scale these partnerships. And with this, we're focusing on, first and foremost, partnerships. North to south exchange of ideas, and south to south exchange of ideas. Because when you talk about exchange of ideas, like the old way of the old way of importing innovations from countries that has different set of priorities and completely different context, doesn't necessarily always work, right? It doesn't really stand the operational realities in developing world. And let's talk about untrained healthcare professionals, problems in electricity, problems in humidity, temperature. It's a completely different operational reality. So how can we create a platform that allows actually for exchange of ideas and exchange of technologies, taking into context the whole different reality of the developing world, and also south-to-south collaboration where the context is a bit more similar, and it's easier to scale in between these countries. So that's what we're focusing on now, and we hope we announce some good news soon.
Great. Well, thank you for that, Yara. That has been very inspiring, and it's great to learn about what the situation is in different areas of the world. So thank you for that. And we really, really hope that we'll see you live, of course, at our upcoming edition of the Future of Health, which is in October, as a live speaker, as you were supposed to be in April. So yeah. Fingers crossed.
Fingers crossed. Really looking forward to come to Slovakia again.
Thank you for being on with me today.
Thank you very much, Thomas. Have a good day.
Thank you. Have a good day.